Hey everyone, welcome to Daily Dose. I'm Chris Riley. And as we head into summer, remember, you may see some diving injuries, so keep these injury patterns in mind. These diving injuries should be treated as a C-spine injury until proven otherwise. This may present from a patient in complete neurogenic shock with bradycardia, hypotension, and warm extremities to spinal shock, which is a temporary flaccid paralysis and areflexia distal to that spinal cord lesion. Remember, spinal shock is a temporary diagnosis. It's not a final state. A lot of patients recover slowly, but they do recover. Neurogenic shock, we're thinking about lesions above T6, so primarily the cervical spine. And that's kind of where we're going to focus on today. We also have to talk about incomplete spinal injuries, such as central cord syndrome, which is caused by a hyperextension injury causing weak arms and preserved motor function in the legs. You also have to worry about anterior cord, which is a hyperflexion injury. This causes motor loss and pain and temperature sensation changes as well. And then the last incomplete spinal cord injury pattern we think about here is posterior cord, which again is a hyperextension injury. This is a little bit rarer because it's the posterior of the spinal cord, which actually helps us with vibration and proprioception. Now, we're not going to go through all of the unstable C-spine injuries because that would be ridiculous in a daily dose, but we're going to focus on the main ones that are seen in diving injuries. The first one we have to talk about is a diving classic, and that is the flexion teardrop fracture. This is an unstable C-spine injury. It almost looks like an avulsion fracture at the anterior part of the vertebra, but what it actually is it's that anterior ligament that's completely disrupted, and this is very unstable. The next one you have to think about is the C1 Jefferson burst fracture, where you have an axial loading injury commonly seen in diving, causing basically an explosion of that C1. It's really important to look for lateral mass displacement with this injury. Next up is an odontoid fracture. This is an odontoid type 3 specifically, but there's type 1, type 2, and type 3. Type 2 and type 3 are unstable. Next up is the hangman's fracture caused by hyperextension. Again, another classic unstable C-spine injury from diving. If you have a patient come into your emergency department after a diving injury, they need to be in C-spine precautions. So remember, immobilize, image early, and expect complexity because these patients can present with all sorts of neurocritical injuries.